Every single time a surgeon makes an incision, they're walking this incredible tightrope. On one side, you've got healing and recovery, but on the other, there's always the risk of unintended harm. Today, we're diving into one of the most delicate challenges in any operating room: how to protect that intricate, fragile network of nerves that controls literally everything we do.
So, let's get right into it. How do they do it? How do surgeons navigate these complex biological circuits to fix one problem without accidentally causing a brand new one? That's really the big question we're going to explore here.
All right, first things first, let's talk about the complication itself. Because while nerve damage is a risk in a lot of procedures, it's often an unseen one, kind of overshadowed by the more obvious concerns people have about surgery.
There's a medical term for this. It's called iatrogenic injury. And that sounds pretty formal, but it's basically a way of saying that sometimes the treatment itself can cause harm. And this isn't about blaming anyone or talking about mistakes. It's just an acknowledged risk that doctors and patients have to navigate together.
And believe me, the stakes are incredibly high. We're talking about an injury to a single nerve that could mean losing the ability to smile, or a permanent change in your voice. It could even lead to chronic pain and weakness that can just completely alter your life forever.
So, if this is the risk, where is it the biggest problem? Not all surgeries carry the same level of danger, right? So let's actually map out the anatomical areas where surgeons really have to be on their highest alert.
The head and neck. Wow, it's one of the most complex, jam-packed regions in the entire human body. It's just loaded with crucial nerves controlling everything from your facial expressions to how you move your shoulders. This incredible density creates what our source material calls anatomical danger zones.
Okay, let's zoom in here on panel A. You see that facial nerve labeled FN? Well, during surgery on the parotid gland, right next to it, that's a salivary gland. This nerve, the one that controls every muscle in your face, is sitting right in the line of fire.
Now shift your eyes over to panel B. That's the thyroid gland. And tucked right up against it is the recurrent laryngeal nerve, or RLN. It's this tiny but mighty nerve that controls your voice box. Any damage here is a leading cause of voice problems after surgery.
And finally, over in panel C, we're highlighting the spinal accessory nerve, the SAN. When surgeons have to remove lymph nodes from the neck, this nerve, the one that lets you shrug your shoulders or turn your head, it becomes incredibly vulnerable.
This table, it really puts things into perspective, doesn't it? Just look at these numbers for temporary injury. For parotid surgery, the risk of having some facial weakness afterward can be as high as 65%. Even getting your wisdom teeth out carries up to an 8% risk. So you see, these aren't just fringe cases. They're significant, well-known risks.
Okay, so this all leads to a really crucial question. How exactly do these injuries happen? If a surgeon can literally see the nerve, why does it still get damaged? Well, the answer is probably not what you're thinking. I think most of us, we picture some dramatic moment, a slip of the scalpel, an accidental cut. And yeah, that can happen, but the source material is really clear that it is not the main reason.
The most common cause? It's traction. Just think about your phone charger cable for a second. If you pull it or stretch it too hard, even if you don't actually cut it, eventually it just stops working right. Well, nerves are pretty much the same. During an operation, tissue has to be moved and held back so the surgeon can see, and that gentle but constant pulling can stretch a nerve right past its breaking point.
Of course, there are other ways things can go wrong. Surgical tools that use heat to stop bleeding can cause thermal damage. A nerve can get compressed or pinched. Its blood supply could be cut off for a bit, or it might even get accidentally snagged by a suture or a clip. So, knowing all these risks and how they happen, how do surgeons fight back? Well, this brings us to the modern prevention playbook, which is this really cool combination of timeless skill and some seriously cutting-edge technology.
Prevention really comes down to a two-part strategy. On one side, you have what you could call the art of surgery. That's the meticulous technique, a surgeon's experience, and delicate touch. And on the other side, you have the science, intraoperative nerve monitoring, or IONM. You can think of it like an electronic early warning system that gives the surgeon real-time feedback on how a nerve is doing.
And that science, it has a measurable impact. One huge analysis boiled its effectiveness down to this single number, 0.66. But what on earth does that actually mean for a patient lying on the operating table? What it means is this: using nerve monitoring technology can reduce the odds of permanent damage to that voice box nerve by about a third during high-risk thyroid surgeries. So it doesn't totally eliminate the risk, but it does significantly tip the scales in favor of the patient's safety, and that's huge.
But what happens when an injury still occurs, despite the best techniques and all this amazing technology? Well, the story doesn't just end there in the OR. There are absolutely pathways to recovery.
So here's the good news. Most nerve injuries are what we call transient. That means the nerve is basically just bruised, not severed, and function typically comes back all on its own, usually within about 6 months. It's a much smaller group of injuries that turn out to be permanent and need more advanced treatment.
And for those permanent injuries, this quote from the research is absolutely key. It says the best outcomes happen with early tension-free microsurgical repair. What that means in plain English is that timing is critical. Getting to a specialist quickly for a delicate, super precise repair gives the absolute best chance for recovery.
So when you boil it all down, what's the big takeaway? Well, protecting a patient's delicate wiring isn't about one single magic bullet. It's a whole system. It's the beautiful harmony of a surgeon's skill, the safety net of advanced monitoring, and then swift, expert action whenever it's needed most.
And that leaves us with one final question to think about. We've seen how tech, like nerve monitoring, has really tipped the scales towards safety. So as we move into this new era of AI-assisted and robotic surgery, what do you think the next big frontier will be in protecting our body's most delicate wiring?